heart is an amazing organ. There is no doubt about it. Why? Well, the heart beats approximately 70 to 80 beats per minute. All right. In each beat, it pumps about 70 to 80 milliliters of blood. So if we did the math for about an hour or about a day, about a year, or the entire life of yours, you will have some crazy numbers. You see, here it's shown per year, 1 year, approximately 3,600,000 times of heartbeat. And then in your lifetime, it's approximately 2.5 billion times. Then you're talking about the volume of blood that's pumped out of the heart. This is approximately 2,000 gallons of blood per day. And the comparison of this function of the heart to that of something else that you deal with every day, like a faucet in your kitchen, and then the water that's flowing through it, its highest volume, would be turned on 45 years to match the amount of blood your heart pumps in your life. So these are all just fun facts, real facts, to show how hard your heart works. All right, where is it located? Well, let's talk about it here. Now, the view of the heart is shown in this way, particular angle, and then the thoracic cavity that's taken out of here and color coded, so you can see all of that much better. Okay, let's talk about it. There are several cavities within the thoracic cavity. So if somebody asked you where the heart is situated, you could say thoracic cavity. That is still correct, but within the thoracic cavity, if you were to go into detail, there are 2 pleural cavities that contain the lungs. Now, between the 2 pleural cavities is this dotted line. The space that is covered by it is what you call as the mediastinum. Mediastinum is where you have it at another cavity, that is pericardial cavity. Pericardial cavity contains the heart. It's shown very nicely here. And now please take a look at the position of the heart. It's somewhat tilted to the left. In fact, what it does is to push the left pleural cavity inward and take a little bit of the position of the left lung. So left lung appears smaller compared to the right lung because of the position of the heart. Now, the heart can be organized into the base here, the broader aspect of the heart, and the narrow part of the heart is what you call as the apex. Okay, so this is like the very tip of the heart inferiorly, and here the upper part is the base. All right, if somebody wanted to listen to the heart, the best position to place the stethoscope would be around here. If you were to look at the ribs and count them, approximately 6th rib is where it should be positioned to get the best heart sounds. All right, so this is the location of the heart within the mediastinum, within the pericardial cavity is where it's situated inside the thoracic cavity. Good. With this, let's talk about the gross anatomy, the external anatomy, or the details that we can see without the aid of the microscope. All right, now let's talk about the anterior view, the posterior view. From the anterior view, we can see quite a few things. We are looking at the blood vessels that are colored in blue, the blood vessels colored in red. Blue refers to here a deoxygenated blood. please note, blue does not simply refer to veins. That's not correct. Blue refers to deoxygenated blood. Red implies oxygenated blood. Okay, we will talk about the names very soon. Well, we also want to talk about the compartments as we see from the outside of the heart, and then we'll go inside and look at the other details that we can see from here. Well, let's do one thing. Let's talk about the blood vessels that return blood back to the heart. The two major vessels that are shown here are the superior vena cava and the inferior vena cava. Superior vena cava and inferior vena cava. So the superior vena cava collects blood from the parts of the body above the heart, and similarly the inferior vena cava gathers blood from the parts below the heart. Both join the right atrium, which you cannot see here. It's actually covered up by this flap. You call this as auricle, right auricle. And similarly, there is one called left auricle. These are basically the extensions of the atria. In fact, they simply don't have any function. They sit over the right atrium or the left atrium. So now let's talk about the right atrium. It receives deoxygenated blood, and from the right atrium, blood moves down to the right ventricle, and from there, it is pushed to the pulmonary artery. Pulmonary artery is shown in blue, very interesting. That's simply because it carries deoxygenated blood. And this blood is now taken to two lungs. So soon, pulmonary artery or pulmonary trunk splits into right pulmonary artery and left pulmonary artery, and right pulmonary artery carries deoxygenated blood to the right lung, and the left pulmonary artery carries it to the left lung. And that purpose here is to oxygenate this blood and simply collect it from the lungs eventually by these four veins. The four veins are shown in red, and that is simply because they are carrying oxygenated blood. They are called pulmonary veins. Two right pulmonary veins, two left pulmonary veins. Obviously, right pulmonary vein from the right lung, left pulmonary vein from the left lung. They collect oxygenated blood from these two lungs and bring it to the left atrium. Okay. Well, I don't want you to be confused because the right pulmonary veins are shown here. Eventually, they make their way all the way to the left atrium, and then they open here. So we collect oxygenated blood into the left atrium. From the left atrium, blood would flow into the left ventricle. This is like a much bigger compartment compared to the right ventricle. In any case, that's where the oxygenated blood would be next, and then it is pumped into the aorta eventually. Aorta is the largest artery in the body, and this is the one that gives blood, distributes blood to the entire body. All right, so just one vessel is how it starts. The aorta, the portion that you see, is probably referred to as the ascending aorta because it's going upwards, okay, leaving the heart, arriving outside of the heart, and then makes a turn, a U-turn. This is what you call as the aortic arch, and then decides to descend, and that's when you call it as descending aorta, and then it goes all the way down into the abdominal pelvic cavity, and there it gets different names such as thoracic aorta or abdominal aorta before it branches off to become different arteries. All along the aorta is shooting off branches. These branches, some of them we may learn, most of them we do not. All right, so that is some external anatomy you picked up. Now let's look at some coronary arteries. Those are the branches of the aorta, ascending aorta. All right, the very first branch is what you call as coronary arteries, right coronary artery, left coronary artery. They further branch and are given different names. Other details are not as important, or we can focus on other details as we see on the posterior side of the heart here. Pretty much the same, I would say. Here is the inferior vena cava, here is the superior vena cava, here are the two pulmonary arteries, here is the aorta, this is now the aortic arch, the four pulmonary veins shown, and then here is a blue vessel that you see. This probably is a good one to talk about. This is called coronary sinus. This is the one that collects deoxygenated blood from the heart itself and empties it into the right atrium. So in addition to the superior and inferior vena cava, we have the coronary sinus that empties blood into the right atrium. All right, with this, let's talk about the internal details. Let's talk about the wall of the heart before we look at the internal details. Okay, now the location probably helped you understand the lining of the heart also. So if you're talking about the space, here is the pink layer. I want you to think about where it would be. Pink layer is what you call as the parietal pericardium. Parietal pericardium is the outermost layer of the heart. There is a space shown in blue, then the visceral pericardium. So between these two layers, that would be the covering of the heart. Okay, and this covering is in addition to the lining of the pericardial space that we talked about within the pericardial cavity, that is the fibrous pericardium. All right, so you're talking about two layers here, parietal pericardium, visceral pericardium, separated by a space, pericardial cavity. This space has a small amount of fluid, pericardial fluid, that lubricates the two layers so that whenever the heart expands, this layer may touch the parietal pericardium and still not stick to it because it's well lubricated and it gets displaced readily. Now, the heart wall also can be organized into three layers. One is the innermost layer, the thinnest layer, you call that as endocardium. Then you have the myocardium, the muscle layer. This is where you have the cardiac muscle, shown in pink. It's the thickest layer. The outermost layer of the heart itself is called epicardium. So endocardium, myocardium, epicardium are the three layers. Please note that the epicardium is nothing but the lining of the heart, that is the visceral pericardium. Yes, that's true. Epicardium, visceral pericardium are one and the same. So that is the wall of the heart and the lining of the heart, that is the pericardium. All of that is shown in a smaller way here and then the expanded way here for you to see. All right, now the thickness of the ventricular muscle is discussed here. What you're talking about is the left ventricle is thicker compared to the right ventricle. All right, that is shown in different ways. When it's in a relaxed form, the chambers look wider. When it's in a contracted form, the chambers look smaller. The important detail is the left ventricle has a thicker wall compared to the right ventricle. The reason being, the right ventricle pumps blood via pulmonary artery to the lungs. The distance between the heart and the lungs is very short, so the force required to pump blood to the lungs is less compared to the force that is required by the left ventricle to pump blood into the aorta, which in turn would have to pump blood to the entire body, which is, quite a distance from the heart. So that is the message from this slide. Now let's focus on the inner details of the heart. Okay, here we are talking about the 4 chambers again, the 2 atria, right and left, and then 2 ventricles, right and left. Now, the blood vessels must be familiar to you: superior vena cava, inferior vena cava. All right, this is the pulmonary artery or the pulmonary trunk, and it's right pulmonary artery, left pulmonary artery, and this is the aorta. These vessels were discussed earlier also. Now, the right atrium receives deoxygenated blood. Then it gets drained into the right ventricle via this valve that you're looking at, that is referred to as the right atrioventricular valve. Right atrioventricular valve, abbreviated as right AV valve. Right AV valve has 3 cusps. The cusps are attached to cardiac tendenni, and then they in turn are attached to these papillary muscles that are attached to the ventricle, okay, right ventricle here. Anyway, the valves are here to prevent backward flow of blood. That's the function of any valve pretty much. And this valve here is allowed to open at certain times and close at certain other times. When it's open, it drains blood from the right atrium to the right ventricle. And when the blood is here in the right ventricle, it would close to prevent backward flow of blood. All right. So now right ventricle leads to pulmonary trunk, and there is another valve that would be pulmonary semilunar valve. Pulmonary semilunar valve is between the right atrium, between the right ventricle and the pulmonary trunk. All right, with this, let's talk about the left atrium, which receives blood from the 2 lungs via the 4 pulmonary veins. All right, and now the left ventricle is separated from the left ventricle by another valve. This is a valve that's made of only 2 cusps, and therefore it's often called as a bicuspid valve, or it's also called as left atrioventricular valve. Yet another name for this is mitral valve. Mitral valve, mitral refers to bishop's hat, and the shape of this valve apparently resembles the shape of a bishop's hat. Anyway, so there are 3 names to it: bicuspid valve, mitral valve, and left AV valve. All right, so again, this valve opens and closes, and when the blood has to be drained from the left atrium to the left ventricle, the valve is open, and the valve is supported by cardiac tendenni and the papillary muscles. They are the ones that open or close. Now, blood is in the left ventricle. This is oxygenated blood. Left side of the heart deals with oxygenated blood. Right side of the heart deals with deoxygenated blood. And right side and left side are separated by a wall. This is what we call as interventricular septum, and there is a thin wall that separates the 2 atria, and you would call that as atrial septum. You can't see it as such, but you have to imagine that to be underneath this pulmonary trunk. In any case, now let's talk about how the blood moves from the left ventricle into the aorta, there is yet another valve here, and that's what you call as aortic semilunar valve. Aortic semilunar valve separates the left ventricle and the aorta. Again, its function would be to prevent a backward flow of blood from the aorta back into the left ventricle. Its opening and closing occurs at different times within the heart. Good. So you got a nice idea about the parts, internal parts of the heart. As I mentioned earlier, left ventricular wall is much thicker compared to the right ventricular wall. Now, the details of the AV valve are shown here. The chordae tendineae are shown nicely, and then the papillary muscle and how it's attached to the ventricular wall. Now, let's talk about the valves. There are 4 valves in total. Remember, the 2 AV valves and 2 semilunar valves. AV valves, the right AV valve is made of 3 cusps, and the left AV valve is made of 2 cusps. And then the semilunar valves, both of them have 3 cusps. All right, this is when the valves are all closed, and we will see when the AV valves are open, semilunar valves are closed, and then AV valves are closed, semilunar valves are open.